my topic is restricted to male infertility, but yes, as all the stalwarts has said, that it's time to take measures now. So this is the graphic representation which shows that the sperm count is declining at an accelerated pace globally. Now, in 1973, where the average sperm count was 101 million per ml, it has gone down to 49 million per ml in 2018. And much more than that, after 2000, the decline is much more rapid. Till 2000, it was minus 1.6% per year, whereas beyond 2000, it has further decreased to minus 2.64% per year. Now, this is again a very important paper by Levin et al., which shows that there is a temporal decline. In fact, it was a linear decline, which I said in my previous slide also, that this first slide shows the total sperm count, whereas this shows the concentration, and this shows the total sperm count. So we very well are able to see that instead of the linear decline, there has been a further very rapid fall. Now, what are the factors that are leading to such decline in the male infertility? Now, we have tobacco, alcohol, obesity, heat exposure, radiation, psychological impact, endocrine disruptors, diet, caffeine, recreational agents. The ultimate crux of all these lifestyle changes is that they lead to decrease in sperm count, motility, morphology, viability, and they lead to decrease in antioxidants also. They alter the spermatogenesis. The Leydig cell function is disturbed, which leads to decrease in testosterone. Now, I would just be discussing about all these factors one by one: nutritional, environmental, obesity, and anabolic steroids. Now, this slide very clearly depicts the orange represents the negative correlation with the male fertility, and the green correlates positively with the male fertility. That means if there is a low consumption of poultry, low intake of PUFA, or low intake of dietary fiber, they all increase the male fertility. Whereas if there is too much consumption of high fats, dairy products, high consumption of potatoes, soya, high intake of total proteins through processed meat, processed red meat, and high intake of saturated fatty acids and trans fatty acids, sweetened beverages, and coffee and alcohol, they all negatively impact the male fertility. Now, coming to very important phytoestrogens, we as gynecologists are very fond of writing the phytoestrogens, especially in the menopausal women. Now, these are the naturally occurring plant compounds, and they are basically known as the dietary estrogens. They are also found in hot dogs, hamburgers, sausages, and other meat products they are used. And they also are used in energy bars, sports, drinks, infant formulas, cereals, and ice creams. And they have been proposed to lower the risk of osteoporosis, heart disease, lipid disorder, breast cancer, and menopausal symptoms. But at the same time, we must not forget that they promote the fat accumulation in adipose tissue, especially in males. Genistein, which decreases the primordial follicles, primary and secondary, in females, and hence they lead to decreased antral follicular count in females also. Hence there is a accelerated follicular decrease in the accelerated follicular decrease. So basically, soya foods, they contain the phytoestrogens. It disrupts the endocrine system in animals. Humans, we yet do not have any conclusive evidence. Potatoes, what do they contain? Now, they contain starch with high glycemic index, which have a detrimental effect on glucose metabolism. Now, this glucose metabolism is important for spermatogenesis. So if there is a hyperglucose levels, then certainly the spermatogenesis is affected. It leads to increased oxidative stress, inflammation, decreased motility, and fertilization. Coming to the meat and processed meat, these contain not only proteins, like we recommend okay, you take non-veg because they contain so much of proteins. The protein component will be good if you take non-veg. But we must not forget and we must be aware that they not only contain proteins, they also contain xenobiotics, especially xenoestrogens, anabolic steroids, and saturated fatty acids. Now, these xenoestrogens, they are lipophilic. They accumulate in fat-rich foods like meat and they have estrogenic effects. Now we know that in males, we want the testosterone estrogen ratio to be high, which means that we want the testosterone to be high and estrogens to be low. So testosterone and estrogens, they play an antagonist role in male fertility. So if the estrogen levels are high, it leads to decline in sperm quality. The saturated fatty acids which are there in the processed meat, it also declines the fertility parameters. Dairy products, milk and cheese. Please note here, I am talking about only the full cream milk, which contains also estrogens, because the commercial milk that we get these days, now 75% of the milk they contain, it comes from the pregnant cows, which contains estrogens, and hence again it leads to the decrease in some sperm production. Again, the processed foods like bakery products, fats, foods, and snacks, they contain the trans fatty acids, which again alter the spermatogenesis in rodents, humans, yet not clear. So, we consume milk, we tell our kids to, okay, you consume milk, but this was an eye opener that they have such high content of estrogens, the commercial milk that we are getting. Again, coffee, caffeine intake, it contains caffeine. Now again, high caffeine increases the testosterone levels, and which is an endocrine disruptor compound. Coming to alcohol. So alcohol, this I'm not talking about the coffee and the alcohol. This I'm not talking about if someone takes in mild to moderate amount. This coffee and alcohol, these side effects and the declining fertility I'm discussing, where there is so much intake of coffee and there is so much intake of alcohol. So, and not in occasional consumers. Then alcohol can interfere with the hypothalamic pituitary testicular axis and impairs the LH-FSH secretion and decrease testosterone levels. Again, the sweets and the sugar sweetened beverages, we know why they are sweet, because sweetness has been added to them. Again, they lead to increased weight gain, obesity, they are increased risk of metabolic syndrome and type 2 diabetes, thereby leading to increased insulin resistance and causing increased oxidative stress. Many contain bisphenol A. These plastic bottles that we use, these Maaza, Coke and all those, they are sold in the plastic bottles. Now these plastic bottles, they have this compound bisphenol A. So gradually and slowly, when this bisphenol A compound is, and even the phthalates also, when it leaches from the plastic containers, it again negatively influences the sperm quality. Now, what are the good products that we should recommend and which helps in increasing the male fertility? We have fish, shellfish, and seafood. They are rich in omega-3 polyunsaturated fatty acids, eicosapentaenoic acid, and DHA. They have anti-inflammatory and antioxidant properties. We do advise our patients to take fruits, vegetables, legumes, and whole cereals because they contain fibers and folic acid. Now, fiber, what happens? Why fiber is good? Apart from the general good health, like it helps in reducing constipation, and it is otherwise fiber is a good component to be taken in your diet. It helps in decreasing the plasma estrogen levels, as it binds directly to the unconjugated estrogens. And folic acid, why it is so important? We gynecologists, like I think we all are obsessed with folic acid. Patient comes to us, wants to conceive, we write folic acid. So similarly, folic acid is important not only for females, but also for males, because folic acid is required for DNA maintenance, transfer RNA, protein synthesis, and hence it is an essential part of the spermatogenesis. Now, there I highlighted that full fat milk should not be consumed, but yes, low fat dairy and skimmed milk is good because this contains the growth factors like the insulin growth factors and the insulin, which helps in spermatogenesis. Now, coming to another important factor, obesity. Are obese men at risk? Yes, certainly. Obese men, they are about twice likely to be infertile as normal men. So this chart, it shows the sperm concentration declines as the body mass index increases. So how does obesity impacts the male fertility? Now, if there is a male who has a BMI of more than 30, it impacts the entire body system and not only restricted to the testes and the sperm production. By increasing, if the BMI is high, definitely the fat is more. It leads to scrotal hyperthermia. There is chronic epididymitis, erectile dysfunction. We all know that it is related to obesity. Obviously, other causes by indirect ways, there is obstructive sleep apnea. There is an accumulation of fats in the peripheral tissues. Now, what happens when there is an excess of fat in the peripheral tissues? We know that the estrogen comes from the testosterone. So if there is so much of fat in the peripheral tissues, there is increased aromatization, there is increased conversion of peripheral conversion of testosterone to estradiol. Hence, estradiol increases, which negates the effect of testosterone, and hence impairs the spermatogenesis. Again, it also leads to an increase in pro-inflammatory cytokines and reactive oxygen species. Thus, the net result would be that there would be increase in DNA fragmentation and sperm epigenetic changes. So again, this I have highlighted that obesity not restricted to fertility, but again, it causes type 2 diabetes, hypertension, dyslipidemia. These are the indirect effects of obesity. By biomechanical stress, it leads to sleep apnea, osteoarthritis, and low backache. Again, the same points. Now, what are the treatment modalities if the BMI is high or if the BMI is high? Now we have 4 modalities. The first and the foremost important is the diet and exercise. We know that by taking good diet, I've highlighted all the points there, and by doing regular exercise, it helps in improving the sperm count after especially, and the effect takes little longer. It is not a magic that the effect will come in a day or so. It might even take 3 to 4 months for the effect to come. Now there are medications also which help in decreasing the fat content and which helps in reducing the satiety, and they help. And once the weight loss is there, then there is an increased sperm count in obese men. Especially if a man is infertile, we can use the aromatase inhibitors, where the conversion in the peripheral tissues from testosterone to estrogen will be inhibited. Bariatric surgery, I would be coming, and of course, when nothing works, we have the assisted reproductive techniques. Just a word about the bariatric surgery. The American Society for Metabolic and Bariatric Surgery recommends to be performed when the BMI in males is more than 40, or if it is 35 with at least 2 obesity-related comorbidities. Now, bariatric surgery helps in reducing the obesity-related comorbidities, corrects hormonal balance, and improves sexual function. The azoospermic men who undergo bypass, there is an increased serum testosterone levels, sperm motility, morphology, and DNA fragmentation. It kind of shows the mixed results. Now, there's a word of caution. It is not that any men we find above BMI 40 or 35, we straight away start telling them to go for a bariatric surgery. Of course, the lifestyle modification is the first and the foremost important modality. Now, what happens in the bariatric surgery? There is a sudden severe weight loss, which may result in decreasing which decreases the spermatogenesis and may initially result in oligoasthenospermia. So just a word of caution, any patient going for a bariatric surgery just because he's not able to conceive or maybe he has comorbid conditions, ideally the sperm freezing should be done so that the rapid fall in sperm count and the motility should be taken care of after the bariatric surgery. Now coming to the environmental toxins. The environmental toxins, we have air pollutants and we have chemical compounds. In air pollutants, we have gaseous pollutants, organic, heavy metals and particulate. And in chemical compounds, we have bisphenol A, phthalates, cigarette, naturally acting phytoestrogens, which I covered, pesticides, and polychlorinated bisphenols. I'm not covering all these in so much of detail because otherwise this talk would have gone very, very long. So I've just concised it. Like key environmental pollutants, these all environmental pollutants, these are endocrine destructive chemicals. Like in pesticides, we have DDT, bisphenol. Bisphenol is there in plastic bottles and in food containers. Dioxins and PCBs like industrial waste and combustion. Phthalates are there in plastics, personal care products like the lipsticks and all, these personal products, bottles, all this is cosmetics, all this contain phthalates. And then heavy metals, we have lead and cadmium. Now, how do this slide might not be very clearly visible, but I would just explain it when we'll try to do justice to this slide. So this endocrine destructive chemicals, as the name suggests, endocrine means they are affecting the entire body system. So, and these chemicals, they are, like I highlighted, these are present everywhere in water, food, air, cosmetics, plastics. You cannot explain them. You touch your wall of you touch the paint of your room and the wall, you will find that it also contains chemicals. The plastic bottles that we are consuming, as we take Bisleri water bottles, maybe we are traveling, or we take them disposable water bottles. So all this, this is just full of chemical compounds. Now, how do they act? They increase the reactive oxygen species and they decrease the antioxidant system. Hence, the oxidative stress is increased, which leads to sperm DNA damage of the sperm DNA, decreased proteins, lipids. It causes apoptosis of the germ cells, and they affect the entire endocrine function. The entire hypothalamic pituitary axis is disturbed, and even the gonads, the function of the gonads is also disturbed, leading to genes and epigenetics and hormonal changes. Hence, the ultimate harm they cause is that they decrease the sperm function and they decrease the sperm count. Now, air pollution definitely decrease the sperm volume count. Particulate matter of 2.5 and more negatively correlates with sperm morphology. These toll collectors where we find they are collecting the toll when we cross any border, like say maybe Noida or from Gurgaon or any toll we are collecting. The studies have shown that these toll collectors, they are working on the expressway, they are more frequently develop the sperm abnormalities. Now coming to bisphenol A, this is found in food packaging, plastics, interior coatings, on metal containers, beverage cans, temperature sensitive papers, reusable bottles, baby bottles, toys, dental composites. So BPA is also mass produced and found ubiquitously throughout the environment. Now, the French authorities, they have totally banned the use of BPA in the baby bottles. And since January 2014, the manufacturing and sales of any packaging containing BPA in contact with the foodstuff has been totally prohibited. So our government also needs to take action. Coming to phthalates, they are found in ubiquitously found in plastics and in others like food, beverages, packaging, soaps, shampoos, everything you name. You just cannot escape the environment that we are living in. It is full of EDCs. Now, very important, cigarette smoking. I guess we all as gynecologists or as fertility specialists, we have seen a rapid and a rampant increase in the incidence of cigarette smoking, not only in men and in females. Like when we were graduating, we never used to ask from the females, do you smoke or do you take alcohol? But now it is become a mandatory question to ask all the infertile couple, that girls, they themselves, even if you forget, they would say, okay, I consume so many cigarettes per day, I take so much of alcohol per day. So, this kind of the social environment that we are living in, it's not a healthy environment. So cigarette, it's the cigarette, the tobacco, it not only comes in cigarettes, it also there in cigars, cigarillos, vapes, and other smokeless tobacco products are there. they contain more than 400 chemical substances such as hydrocarbons, alcohols, phenols, and heavy metals. So we all have seen that these smokers, they require twice as many as IVF cycles to achieve conception compared to non-smokers. There's a reduction in the sperm count by 22%, because what happens when there is so much of smoking, the sperm parameters are deranged. The sperm do not have the capacity to bind to the zona pellucida and fertilize the egg. So it's not only the even these vapes, these electronic vapes, or maybe these aerosols in these vapes, which are fumeless. In fact, to my knowledge, the Indian government has banned vape and not the smoking, contrary to what these young students and all, they were taking, because the aerosols in these vapes and all, they are much more harmful and toxic to the lungs as compared to the smoke fumes. And even the ACOG do not recommend marijuana if during the periconception period to both the male and the female. The AICOG committee opinion also suggests that cigarette smoking, it has a mutagenic potential also. There could be chromosomal errors also, and DNA damages to the human germ cells, which may result from the tobacco smoke exposure. Hence, so much increase in the risk of chromosomal mutations in the babies being born. So, does the smoking cessation always leads to the increase in sperm count? Well, it depends upon how much smoking the person has been taking, and totally it cannot be reversed. If such a heavy consumer, it is not easy to quit smoking at one go, but yes, few positive results may be seen within an year of cessation. Now, this was a very important factor, so I just brought it out, that even the paternal cigarettes is associated with decreased AMH count in the adolescent girls. And when Ireland banned smoking in workplace, the rate of the preterm birth dropped by 25%. Now, coming to the anabolic steroids and the testosterone therapy, which all these young men are very fond of taking. It has become a kind of fantasy to go to the gym and take these protein supplements. So, because the male testosterone production, it decreases over time. These testosterone, these variety of tops testosterone boosters are available in the market, and because they help in improving the physical performance, weight management, they help in increasing the muscle mass, they provide healthy sex drive, memory recall, and balanced mood changes. Now, 6 things that lower the testosterone levels. Of course, there are many more. I just brought this slide. The too much exercise, poor diet, serious illness, sedentary, alcohol, and stress. So now these testosterone, these are detrimental on spermatogenesis. They do cause, because once the testosterone levels is high in the body, while you're taking them artificially, it impacts your hypothalamic pituitary axis. There is a negative feedback mechanism, and thus there is no production of LH and FSH, and hence it leads to hypogonadism. Time frame for this recovery, recently I have a patient who is a gym and a bodybuilder. The sperm count is very low, but then he says, ma'am, I have to take steroids. I have no option. So time frame for this recovery is highly variable. The baseline, it depends upon the baseline testicular function, drug use, and age at the time of cessation. In some men, drug cessation alone may not help the spontaneous recovery, where you need to give drugs, maybe medicines, oral drugs like aromatase inhibitors or clomiphene or SERMs, or if it doesn't work, then gonadotrophins if the hypogonadism is so severe. Now, so in nutshell, I have said that diet, nutrition, substance abuse, stress and maternal health, environmental factors, BMI, sexual habits, sleep, circadian rhythm, they all impact the male fertility. So what is the way forward? That we need to be physically active, take good nutritious diet, avoid the substance use, do proper weight management, and avoidance of toxic exposures. So just the take-home messages is that moderate caffeine consumption, maybe 2 cups per day, and moderate alcohol consumption, that is 1 to 2 drinks per day, are considered safe during the preconception period. Patients should abstain from smoking, vaping, or using cannabis products in any capacity given evidence in the current literature. Patients should consider organic food options or thoroughly wash their products before consumption. Canned food, bottled water, fish with high mercury content should be avoided. And at the end, the use of plastics should be minimized as far as possible. And with this, I thanks everyone and Sharda ma'am and RK sir for giving me this opportunity to present this talk, and I stop share my slide.
Thank you, Dr. Shalini, for a very, very comprehensive talk and covering every aspect, I think, which is possible in this shortest time. So I will request now our chairpersons, first of all, Dr. Renu Misra ma'am, to give her comments.
I think Shalini has covered all the factors, how and they can affect male fertility and bring about epigenetic changes in men to affect the sperm counts. Interestingly, once I was preparing a talk, this is a long time back, on infertility, and I was exploring the net, and I came across a very catchy title. It said it was in the Daily Mail, which is a UK tabloid. Which is also
Ma'am, your voice is not that very clear. Please come closer to mic.
Okay. Yeah, is that better?
Yeah, better.
Okay. So I was just exploring to prepare a talk on infertility, and I came across a very catchy title on the net on Daily Mail. This is a UK tabloid, which said, "Is the human race going to be extinct?" And when I read, it was actually referring to a paper which was published recently from Levine, which Shalini has already quoted these studies, which showed that how these sperm counts have been declining. And it is not something which is specific to a country. He had done study which was comprising of all white race countries like North America, Europe, Australia, New Zealand. And then again he published another meta-analysis in 2023, where he now covered Africa, South Asia, and all these other countries which were not covered earlier. And like she said, he showed very categorically that there is a decline in sperm count almost 1% per year, and after 2000, it has started declining 2%, 2 to 2.5% per year. So that was the reason that the paper quoted that is the human race going to be extinct. So, like once I was reading a WHO report, and it said that countries which have a high fertility rate also have the highest infertility rate. And it was actually referring to South Asia, like countries like India, Pakistan, Bangladesh. So we as gynecologists have a duty that not only we need to make contraception where it is required, but we also need to create awareness about the increasing infertility, about falling fertility, both in men and women. Like last time I covered a talk on premature ovarian insufficiency. Similar problems, I suppose, in men and women. Lifestyle, all the environmental toxins, all the things that we have incorporated in our life and we think we can't live without them, they're actually destroying us. And the sooner we understand and we actually create this awareness in the public, the better, before things really become sort of irreversible. But thanks, Shalini, you covered beautifully everything.
Thank you, ma'am.
Dr. Jyoti Bali, please give your comments. Dr. Jyoti is there. So meanwhile, I'll request Dr. Sharma sir for giving his expert comments, please.
It was an excellent talk by Dr. Shalini. She covered almost everything. I remember one case, who had come from America, male factor infertility. And what they had done was they were testing the lead level in his sperms, which I had never heard of in India. So basically, he had been taking some Ayurvedic medicines and all. So when we are talking about the male infertility, we should also ask him what other medicines he has taken earlier. And his lead content was very high. They said that is the cause of your infertility. Otherwise, count was everything was all right, and every time there was a fertilization failure. So the lead count in the sperm, this was the first thing which I heard about it. And then he told me that he was taking some Ayurvedic medicines which contain high amount of lead. So one has to be very, very careful in taking the history of any other medicine besides, the allopathic medicine if he has taken. That could be, the cause of the infertility in these males. And the second thing which I find besides, the decrease in the sperm count is the decrease in the libidos nowadays because the stress factor, different working hours, the wife is working the day, husband is working in the night, and they are not able to make it at the right time because somebody is going for some company job in between. So this is again a fertility disruptor. Besides the endocrine disruptors, the job disruptors are also the cause of increasing the infertility in the males.
Sir, this test is available, testing lead
No,
levels.
India don't have. I've been searching because we may be having because again, Madam had brought about the fish is good for these patients, but then in the Yamuna river, the mercury and the lead levels are very high due to the industrial toxins. So the fish are supposed to have more dioxin, more fish. So we have to tell them even if they're taking fish, it should be in moderation. Otherwise, they will end up with more dioxin and lead and mercury in their system.
Sir, I think the levels of testing lead levels are available. I will let you know because my brother was talking the other day that one of his patients had a problem and some endocrinologists had picked it up. So the levels must be available here in this country. Then only he was talking about it. I will let you.
Ma'am, no, ma'am, they're available.
They're available.
For sure. Yeah, because we
No,
have.
it is talking about the semen, not in the blood.
Yeah, not in semen, but blood.
I'm talking about the semen.
Yeah. But sir, in US, they actually test regularly. Every year, my granddaughter, she has a blood test, which includes the blood level, lead level also. I was very surprised. I said, why are they checking for lead level? They said that's their screening procedure.
That's actually very nice.
Yeah.
So, Dr. Sharda Jain, ma'am, your comments for the topic.
I think I am overwhelmed by Dr. Shalini's presentation. Wonderful.
Thank you, ma'am.
Thank you, ma'am. So, Dr. Gautam Banga, Dr. Seema Sehgal, are they there? Dr. Jyoti Bali?
I think is it the OPD time or anything?
Yeah.
Anyway, we'll call it today.
Right, ma'am. So thank you once again, all the seniors, Dr. Sharda ma'am, Dr. Sharma sir, Dr. Renu Misra, everybody who joined. Thank you, Dr. Shalini, for a wonderful talk, and special thanks to Dr. Sharda Jain ma'am for bringing up this topic because not many people are talking about it. Then to choose the topic out of all, which is actually very relevant and important. And all of us need to be sensitized about this. This again, I'll say declining fertility rate. We all need to be sensitized about this. We need to talk more and more about it in different forums. So with this note,